I believe the United States is faced with two tremendous public health crises right now. The first, of course, is the problem of chronic pain.
There's 75 million patients with chronic pain out there that oftentimes aren't being treated as well as they should be. And one of the biggest classes of medications that we do use to treat chronic pain patients with are opiates.
Hydrocodone is the most prescribed drug in the country. Not just the most prescribed pain medicine, the most prescribed drug in the entire country is an opioid.
The uses of these medications has skyrocketed over the last 10 or 15 years. Somewhere between 5 and 10% of the population is addicted to opiates.
We've also seen a tremendous problem emerge in diversion, in unintended opioid-related overdoses, particularly amongst the young.
You have to be able to prescribe the drugs that you need, but you have to be aware that prescription drug abuse is a problem in of itself in our communities.
People think they, quote, know an addict when they see one, or know a drug dealer when they see one, or that kind of thing. The truth is, we are not mind readers.
I don't think there's anybody in this country that can pinpoint with 100% certainty that their patient is going to be completely innocent of having any problems with these drugs.
I mean, these pain medicines actually represent currency. I had patients selling their medicines to buy groceries or to buy their other medicines.
But you also have the accidental addict who is still your patient for years, and they've developed a dependence on it. They don't want to face it. And your only protection against that is to monitor for the patients using it properly.
The easiest way for a lot of clinicians to track compliance and to prevent abuse and diversion is through urine drug screening.
There are agencies overseeing the writing of opiates. The DEA is involved, the Department of Health, your local law enforcement agencies. Everybody is concerned about this national epidemic.
It seems to me that having reports back from a lab that basically suggest that the patient is taking what you're giving them, not taking something that you're not prescribing them, and not using illicit drugs goes a long way as part of your medical record to say I'm treating pain and I'm taking a reasonable step to try to make sure that the patient is not abusing or diverting.